Okay, good morning, everyone, and welcome to the Pacific Islanders broadcast, Voice of South Pacific from Seattle, Washington at the Manamo'i Center. Today is November 25th of 2025. Thank you, Dino, for the Seattle King County Public Health for coming on and keep sharing, this great information, to educate our Pacific Islanders communities and be aware of safety and, stay healthy and a good health measures, like to keep everybody safe. So our topic for today, because we're running late, sorry everyone, we have the little coconut time today. But thank you for your patience. And I'd like to introduce Andy Lyons and also from the vaccine health educator from the Seattle King County Public Health. I'll give you a little time, just, like a couple minutes, please introduce yourself and also your colleague. And then we'll continue on, start asking questions. And for those of you that tune in and listen in, you can go ahead and just write a question on the chat box, and we're happy, to pass it on and have them answer it. Any concern or anything, that you wanted to share about the vaccine. At the same time, we have questions, to ask. Okay, I'll give you the opportunity. Andy Lyons.
Thank you so much for having me, Sylvia. As you said, my name is Andy Lyons, and I work at Public Health Seattle King County on our vaccine team, which is located in the branch of communicable disease, epidemiology, and immunizations, which is a huge mouthful. But basically, we're looking at all of those different diseases that are spread amongst one another between humans and what we can do to sort of prevent those and how we can track them to make sure we sort of know what's going on in our community and keep ourselves and each other safe and healthy. And I, in particular, usually focus on vaccines for children and youth, but luckily, there's many of those vaccines are the same ones that adults and younger adults and older adults use, especially when it comes to this season. So I may not be an expert on those, but I can certainly answer questions. And then along with me, I have my incredible colleague, Kate Cole, who really focuses on how we communicate about all of these things and how we make sure that our communities understand and know what we need to know, even if you don't spend 8 hours a day thinking and talking about vaccines like I do.
Yeah, hi everybody. Kate Cole from Public Health Seattle and King County. I'm on our communications team and mainly here just to listen in and learn from Andy, but also really learn from all of you and the questions that you have or that you're hearing from community. So thank you so much, Sylvia, for hosting us.
Kate Cole, you look different, I thought it was just like a little high school girl.
I'm in Southern California right now for
Oh, that's nice and
holiday, so
warm.
it's
Yeah,
it's hot out and I get to wear a tank top.
Yes,
right.
why not?
Yeah, in the meantime, although that we are starting late, we can always make it up, like to get our whole hour complete. Don't worry about it, we have time for that. But if you have to leave, and that's fine also. But yeah, I would like to also introduce, like Pastor Aseri from the islands of Fiji. In our culture, if you could just give you 1 minute, Pastor Aseri, to just lead us with a little short word of prayer, and then we'll continue on.
Okay, let's just pray. Heavenly Father, we thank you for this beautiful morning that we can come together, enjoy one another's presence, and also, Lord God, in the assignment that is before us in addressing issues of God that we deal with it every day. And we're so grateful, Lord, that we have people that have expertise in these areas of God will come and address it and help our community in getting to know what we need to know here today. Bless us In Jesus' name, amen.
Amen. Thank you so much. Okay, for this opportunity, I see our guest, from our Tongan community. I would like to, to give the first opportunity. Pastor Aseri, would you like to ask the question, like if you have any question about the dealing, with the vaccines? I know a lot of people have questioning about, the vaccines, and today we can learn more because this is the vaccine educator, from our Seattle King County Public Health. So can you ask the first question, Pastor Aseri? Then we'll go on to Elizabeth Iafu Kamoto and also Luisa now.
Yeah, I think my first question is, as far as general health, the importance, I just want to know the importance of having vaccine.
Yeah, that's a really good question. So there are all kinds of things that contribute to our health, right? And some of those are things that we do day in and day out. So getting enough rest, eating lots of different types of foods, drinking water. They may be, washing our hands frequently, especially in the winter, covering our mouths and noses when we sneeze or cough, right? So we're preventing the spread. So all of those things can help keep our body's immune systems working really well. And vaccines are a part of that picture as well. So vaccines are sort of like school for our immune systems. So our immune systems work best when they've sort of met whatever kind of disease, virus or bacteria, when they've met those before and they can say, I know what this is and I know what's going to take care of these things. And that's often why we see little kids get sick really frequently, right? I've got 2 kids and I remember the first time they were in preschool or daycare that first year, it felt like they were always sick. And that's because their immune systems are learning about all of these diseases. By the time we're older kids or adults, our immune systems have gotten used to and have met lots of those diseases. And so we might get a little bit sick and then our bodies are able to fight those diseases off. What vaccines are really good at is teaching our bodies how to fight those diseases before we get sick. So for some more serious diseases like measles or whooping cough, those are diseases where we don't want our bodies to be learning how to fight those diseases off by meeting them in the wild. We want our bodies to have some study beforehand, right? For other diseases that are more common, like the flu, maybe, right?
Yeah.
Those diseases are a little bit different because they change tactics. So it's sort of like the enemy putting on a disguise each year. So it maybe takes our body a little bit longer. So that's why we get a flu vaccine each year. And then our body says, okay, this year the flu is disguised as, a clown. So I'm going to be on the lookout for the flu and the clown costume, right? It's all a metaphor. Hopefully it's not too confusing. But so vaccines help us stay healthier. Because they teach our bodies what to look for. They may not entirely keep us from getting sick, but usually what they mean is that we don't get as sick for as long. And for some of us, that just means, instead of having to take a week away from work, we only have to take a day. Or instead of feeling super sick and stuck in bed, we're just a little run down and have to stay home. But for some people, especially for babies, for people who are already more likely to get sick, for older people, it can be a huge difference. And so having a vaccine can mean the difference between getting sick and ending up in the hospital, or getting sick and potentially dying in some really bad cases. So that's how vaccines contribute to our health overall.
Thank you so much for the answer.
Yes.
We'd also like to welcome into our program today Bessie Kamoto, but also Lini Puloka. Welcome to the program. We'd also like to keep going with our questions. As you have mentioned, now is winter, And of course, more people are getting ill, very much illness. Other than Kate, she's having fun in the warm weather of California. But is flu really that serious? As you have mentioned earlier, that flu is one of those vaccine that we are encouraged or we should be getting so we don't miss work or school. So my question is flu really that serious? Is it really important to get the flu shot?
Yeah, so sometimes we think of the flu as just being, one of those things that we deal with in the winter, right? And for many of us, especially those of us who are younger or who are generally pretty healthy, it can just mean feeling pretty yucky, right? We get fever, our bodies ache, we're super tired, we've got a sore throat, right? And we're stuck in bed. So for a lot of us, that's the worst of it. And that might feel like not fun, but, is it really that bad? Unfortunately, there are some people who are at higher risk, and it really can mean being in the hospital or even death. So we monitor it really, really closely at the health department because it can have those bad outcomes. About 50,000 people each year die from the flu that we know of. So it
That's
can
a
be
lot.
really hard for us to know exactly how many people are dying from complications of the flu. But we know that it's at least that many, right? 50,000. And that does include some younger, healthier people. People who are younger adults or teenagers are less likely to be hospitalized or die, but it can happen. And so we definitely want to avoid it, not just because we don't want to feel bad, which I don't know about you, but I got too much to do to be stuck inside in bed, right? Especially this time of year when there's so much fun to be had and so many people to see, right? Family, holiday celebrations, all of that. But also because it really can mean getting very, very ill. So the great thing is there is a flu shot, and each year it's a new flu shot. I know nobody likes getting more than one shot, but each year the flu changes a little bit, and so we're able to sort of give a pretty good. Usually, we can make a pretty good guess based on what's happened in the rest of the world to adapt our flu shot, update it so that again, when the flu shows up and it looks a little bit different than it has in the past, our bodies can recognize it. And then even if we do get the flu, we're less likely to get very, very sick from the flu, or hopefully we can just avoid getting it altogether. So, and how does that work, right? If you're a younger, fairly healthy person, you say, well, maybe I'll take my chances. But if you don't get sick or you don't get as sick, you're also less likely to spread the flu to other people in your life who are more vulnerable, right? And I know that we care about our families, and so we want to keep our grandparents healthy. We want to keep our little babies healthy. We want to keep the people who are going through chemotherapy for cancer healthier. And so all of us can contribute to that by getting vaccinated.
Right.
Okay.
Thank you so much. We'd like to leave it out for some of the panels if anyone out there has any questions.
Bessie.
Or can we ask Bessie Kamoto if you could ask the next question, please?
Hi, Bessie, can you hear us?
Yes. What are the side effects of taking those vaccines?
Really good question, and definitely something that comes up for people. So it depends on the vaccine. Most of the vaccines, especially the ones that we think of for this time of year, so that's the flu vaccine and the COVID vaccine for most of us, have pretty mild side effects. So most common is that we'll have a sore area of our body wherever we get that shot. For most adults, it's going to be in your upper arm. Sometimes for younger babies, like 6 months old to 3 years old, it might be in their upper thigh. So that's the most common side effect is some soreness, maybe a little bit of swelling at that area. Some people will have some other side effects, like they might get a headache, they might get a little bit of a fever, they might get some body aches or just kind of feel run down. Most of the time, that lasts a very short amount of time. And it's actually, even though it's not fun, it's actually a really good sign that our immune system is responding. Those things that we tend to think of as what makes us feel yucky, right, when we're sick. So a fever, aches, body pain, headaches, things like that. That's actually our immune system fighting off those viruses. And so when we have those side effects after a vaccine, it's actually proof that our immune system is doing what it's supposed to do, but it's not fun. Now, there are some cases, very rare, where somebody might have a larger, more significant side effect. It's very uncommon, but it's not, it does happen. Most of the time, those things will happen pretty soon after a vaccine is given, which is why often your doctor or your pharmacist might have you hang out for a little bit after you get a vaccine, just to make sure that if anything really bad is going to happen, it happens immediately. And then usually we are able to sort of adjust and make changes for individuals. So there are some people who have allergies to ingredients in vaccines. There are often options for them so that they can still get vaccinated. Or for those people who might not be able to get a vaccine, that's another reason for the rest of us to get those, right? So because they're rare, the significant, the really big side effects, most of the time, most of us might just feel a little run down.
Thank you.
Andy, I'm going to chime in here. I wonder if this would be a good time for you to talk about the fact that vaccines do not cause autism. I know sometimes people think that or have heard rumors that they are associated. And I know you're great at talking about the fact that they are not associated.
Thank you,
Yeah.
Kate Cole, for bringing that up. Yeah.
Yeah, so, and this is a conversation that it has been happening for a while, but you might be hearing more about it right now for lots of different reasons. We know because we've done, and by we, I mean the scientific community, right? The public health community has done tons and tons of really strong studies that autism is not caused by a vaccine. Now, I say that, but we don't have an answer for what does cause autism. And that's because autism is really complicated. So we know that it is a really strong genetic factor. So that means that we tend to see autism run in families. But there are likely other things that influence autism. So it may be things in our environment. It may be things that happen during pregnancy or during conception. We don't know all of those things. And that's because it's not just like a light switch that you turn on or off, right? Autism is much more complicated than that. But we've been able to do a lot of studies around the world with lots of different populations of people, and there's no evidence that autism is caused by vaccines. And unfortunately, this is a rumor that was started by somebody who was not being honest and was not being ethical. So there was one study that happened in the 1990s, so a very long time ago. And we know that this scientist who published this study falsified the data. So it wasn't just like, oh, it wasn't a good study. It was actually a study that was harmful, where he was trying to serve his own agenda. So, because of that one little study, it blew up and is now something that people talk about all the time. And I just want to say that I understand why this is a concern to people, right? We all want to do everything that we can to keep our children healthy, to give them the best possible chance at life. I have a son who is autistic, and I love him and adore him, and he is a wonderful human being. And there are things that are challenging for him. And I, as his parent, want to make life as easy as possible for him, right? But I also know that part of making his life easy is making sure he's healthy. And so for me, that means making sure he's vaccinated against all of those possible diseases. So I know that it's really important to people and that vaccines can feel scary and autism can feel scary, but vaccines, we have all kinds of evidence to show how many lives they've saved and how healthy they've kept us, but we don't have any evidence to suggest that they cause autism.
Right. Thank you. Very important. Now, could we please hear our next question from Lini Puloka, who's here. Lini?
Hi, Lini. Can you are you able to? Lini? I think that please unmute your phone. Okay. In the meantime,
Would I be able to ask a question?
yes. Go ahead, Pastor Sally.
Yeah, just a quick question. Having to be vaccinated before traveling out of town, would that be something advisable, or what do you suggest?
Like
Yeah,
visiting.
so this is
Yes.
such a good question, right? We really recommend that people are up to date on vaccines, especially if they're traveling outside of the country, right?
Yeah.
And that's because different places in the world have different diseases, which are what we call endemic. And endemic just means they're kind of around all of the time. And so sometimes those diseases that are very common in one place in the world, if somebody goes and travels there, they may not have been vaccinated against the disease, or maybe they were vaccinated a very long time ago with a vaccine that over time starts working less and less. And then they might bring that disease back to their community. So a really great example of this is measles, right? And I know measles has also been in the news a lot. So there are some places in the world where measles is unfortunately very common. And there are lots of different reasons for that we don't have to get into. But here in the United States, while we are having more and more measles cases, we still, in general, don't have it widespread, right?
Yeah.
But if people travel and they maybe aren't vaccinated, or let's say you have a baby who is a little bit too young to get vaccinated, maybe your baby is 9 months old. Most of the time, babies get vaccinated for measles around 12 months for the first time. And you go to this other country, that baby could get sick with measles. So in the case of measles, if you've got a baby who is maybe between 6 and 12 months old and hasn't been vaccinated, we would recommend and they're allowed to, right? It's safe for them to get vaccinated a little bit earlier so that they're safe. There are also other diseases that we don't regularly vaccinate for in the United States because they're just not things that we have here. That you may want to get vaccinated before traveling to another country. And if that's the case, you can always talk to your medical provider about what those recommendations are. But it's always a good idea to make sure that you are up to date on your vaccines. And when it comes to just our regular, sort of more common vaccines, right? Flu and COVID, it's a really good idea also to make sure you have those vaccines before you're traveling. You come into contact with lots and lots of people from all over the place, and that's how diseases get spread really easily. So making sure you're vaccinated before you travel is a really great idea.
Thank you.
Appreciate it.
Just wondering, now that we're discussing a lot about the vaccine,
Right.
where can we, if it's my first time wanting to get the vaccine, whether for measles or for the flu, Where here in the King County can we contact to get it, and what are the costs? If there's any cost for these vaccine? Thank you.
Really good question. So, most insurance plans will cover most vaccines, including like flu and COVID. Those are some of the ones that are common. Also, RSV, which is important for pregnant people and for older adults, and for new babies if they're born during the winter time. So flu and COVID and RSV, all of those are covered by most insurance plans, including Medicaid plans like Apple Health and Medicare. And we are so lucky that in Washington, all children up through age 18, so until their 19th birthday, can get not only, they can get all the recommended childhood vaccines through the childhood vaccine program. So for kids especially, there's lots and lots of opportunity. Most of the time, your doctor's office, including community health centers, places like CMAR, Health Point, things like that, they'll be able to offer vaccines. And then many pharmacies do as well, including places, big chains like Safeway, Fred Meyer, but also there are a number of smaller local pharmacies that also offer vaccines. We have a website, or we have a map on our website. It's kingcounty.gov/find a clinic. And on that website, there is a map for adults who are uninsured where you can find no cost vaccines. There's a map where you can find providers in the childhood vaccine program. And then for some folks in certain locations, we do have some mobile clinics available, and those will also be posted on that page. So that Find a Clinic page is really, really great. We do always recommend if you're, looking at a pharmacy or a clinic like CMAR, that especially if you're not already a patient there, you call ahead and just make sure they've got the vaccines you're looking for, find out what their expectations are around if you need an appointment, if there's going to be any out-of-pocket costs to you, things like that, just to sort of make sure instead of just showing up. But all of that information is on that page, and I can put that in the chat if that would be helpful.
Thank you. Also, we have here a question from Hokulani. We're getting into the winter, which is when more people, of course, are getting more sick. And I know you mentioned, but what illnesses should we also be watching out for? Besides the measles, also the flu you had already mentioned. How about COVID? I'm just asking on top of that.
Yeah, so sometimes we talk about COVID like it's something that happened in the past, right? And COVID is still around. It is not the same level of panic that we had 5 years ago, right? Which I'm very grateful for. I'm sure you all are as well. But we've learned that COVID is actually kind of similar to the flu because it does change over time. So it mutates. And that's why even if you got COVID vaccines back in 2021 when they were first coming out, it's important to get updated COVID vaccines each fall into the winter. And that's because COVID does tend to change over time. And so those vaccines, the updated ones, are able to respond to or kind of be specialized for whatever changes have happened. So COVID is important. And, COVID also can cause more serious outcomes, especially in really young babies and children, in folks who are already ill or who have some immunocompromising condition, either because they're going through cancer treatment or maybe they have a medical condition, and for much older adults. The other thing that we want to be aware of is that all of us, no matter our age, are at risk for long COVID, which people may have heard about, but it's where you sort of have these ongoing issues that have been caused by COVID infection. They can cause things like dizziness, brain fog, fainting, just generally feeling kind of fatigued all the time. And COVID vaccines help reduce the chance of us getting long COVID. So even for those of us who maybe COVID just feels like a cold when we get it, by getting vaccinated, our chances of developing long COVID are reduced. So in addition to flu and COVID, which are great for everyone 6 months and older to get every year, there's also RSV, which is acronym for respiratory syncytial virus. So that's why RSV is much easier to say. RSV is a very common virus, and for older children and adults, it's kind of like just getting a regular cold. But for tiny babies, especially those who are just born, it can be incredibly serious. And there are lots of babies who end up in the hospital each year from RSV. So the RSV vaccine is one that can be taken by pregnant people during the last few weeks of their pregnancy. And that protection will pass from the parent into the baby, and it'll keep that baby safe for those first few months until their body is able to get exposure. If the mother isn't able to get vaccinated with the RSV vaccine when pregnant, then new babies can also get something similar. It's a type of immunization, but it's not a vaccine. That feels confusing. It's okay, but it's what we call a monoclonal antibody. And basically, instead of teaching your immune system how to fight off the disease, it's sort of like somebody lending you some soldiers from their immune system, and those soldiers will work for a short period of time. So that's another option. RSV is also it can make older adults very sick. So the RSV vaccine is also recommended for older adults, so people who are 65 and older. And the last one is whooping cough. Whooping cough is a vaccine that many of us get when we're children. And then we want to get a booster every 10 or so years. And the vaccine that protects against whooping cough is either Tdap or DTaP. It's the D in that, which is diphtheria, but we call it whooping cough. And it's really important, again, for pregnant people to get that because it protects those babies. And if you've got a new baby at home, you want to make sure everyone in your family who's going to be around that baby is also vaccinated against whooping cough, because tiny babies are too young to get vaccinated themselves, but can get very seriously ill from whooping cough. So those are really the big ones that tend to be around in the winter that we can protect against with vaccines.
Thank you.
Yeah, thank you. Thank you so much, Andy Lyons, for the most relevant information about this time of the winter and a flu season to share about the safety of the vaccines. And also, I have the opportunity to please give this to Luisa Nakamoto. Luisa Nakamoto, before we continue on with Luisa, I wanted to pass on, a question from Vecinia. Vecinia was asking, what about the people that are having like chronic disease, or maybe, their body is kind of maybe the elderly? Is it safe for them to do the vaccines, or it's not safe for them to, because this is a medicine,
Yeah. So for individuals who have chronic illness, who are very, very sick, they should speak to their medical provider about specific vaccines. So it's really going to depend on the vaccine and then also on what conditions that individual has. And there will be times when, if people have certain chronic conditions, that a vaccine is not recommended for them. And it's also possible sometimes that there are different formulations or different ways of delivering that vaccine that might be an option for them. So, anytime somebody has any sort of ongoing medical condition, we recommend you talk to your medical provider about the specific vaccines, what they
Right.
recommend for you,
Do you hear
if there's
that,
a certain
Dr. Moore?
schedule they recommend.
Talk to your medical.
But I think it really speaks to why those of us who don't have chronic medical conditions, why it's so important for us to get vaccinated. So, for example, even though I myself might not be at high risk for serious disease from flu or COVID, these or any of these other diseases. I have parents who are in their 70s, both of whom have some more chronic conditions. And so I want to make sure that I'm not bringing diseases to them when I go see them, right? So I want them to get vaccinated for everything they can. But if they can't, knowing that I'm vaccinated, my children are vaccinated, right? It's sort of like creating a little bubble around our communities. So, vaccine, that's why we consider vaccines public health, right? Because I'm protecting myself and keeping myself healthy. But by doing that, I'm also protecting my community. And that's really why I think vaccines are so cool, right? Is they're not just about me, they're about a community and all of us showing up and doing what we can. So not everybody can get vaccinated, and that's okay. But if as many of us who can do, then we keep those people who can't safe.
Thank you so much. You know, you answered correctly. And so I want to say something in my native language. Kapau lewa o kumo ngoi o ku kapau kumo whakoutua pe wa ngai maha ki tauhi. Pea o ku whema o ke mohuhu. O whema o ke mo talanoa ke o mo toke tā ke mahino. O safe pe pe whiunga ho mo sino malohi whiunga ke whae hoho. Kai ke mo o hoho na ku fu o malohi ai hoho kia te mo
Di mai
tau.
ki whehu ia to.
Yeah. Okay. Go ahead.
Hi, I'm Lini Puloka. So my question is, what's the difference between vaccination and immunization?
Oh, good one.
Oh my gosh, such a good question. Incredible. Yeah, so a vaccine is actually a type of immunization, and that maybe feels confusing, right? But basically,
kind of
when we
confused.
yeah, when we immunize ourselves against something, it means our bodies are protected against a disease. The most common way that we immunize is through vaccination. And the biggest difference is that immunization can mean any sort of protection. So it's kind of, if you want to think about it like an umbrella word, right? So it can cover a few different things. And then vaccination is a specific thing. Vaccination or vaccines are when we put some kind of medicine or material into a body that teaches that body how to protect itself. So it teaches our immune system, this is how you fight off the flu, or this is how you fight off measles. Most of the time, for most of us, that's the only type of immunization we'll get is a vaccine. There are a few cases where some people can get a different type of immunization. The most common of that is monoclonal antibodies. And that happens in RSV and sometimes with COVID. And usually those happen because a vaccine isn't appropriate, like it doesn't work for a person of a certain age or with certain conditions. So in the case of RSV, little babies, so newborn babies, we can't vaccinate them against RSV, but we can give them a monoclonal antibody. And so basically what that means is instead of giving their bodies instructions for how to make the soldiers needed to fight RSV, we're lending them the soldiers. Those soldiers only last a few months, whereas when we teach our bodies how to fight something off with a vaccine, it tends to last longer. That's sort of the simplest explanation, and I know it still may not be super clear, but basically what you can think of is that when we're talking about immunizing ourselves against diseases, we're going to do that with a vaccine. And you can kind of use them interchangeably.
Thank you.
Hopefully that helped a little.
Yeah, it's clear.
Now
Thank
we
you
can
very
see
much.
you. She's driving on the road and then she's able to do her broadcast. Okay, well, Luisa, now, are you still in? Oh, Bessie? Bessie Kamoto? Okay, now,
Yes, Tina, I'm still here, but I
Okay.
don't have any extra question.
she have a question or not? Okay, Felicia, go ahead. I see that you raised your hand. Felicia, go ahead and ask your question. Felicia? Okay, who will be the next one?
So while we're waiting for someone to have a question, I'm just gonna mention the fact, or if you can clarify, besides the flu, and you also mentioned about the measles and autism, not being causing, the vaccine does not cause our children to have autism. My other concern or question about what are the other serious vaccine or illnesses other than the flu that we should be aware of? I asked this other question earlier, but is there others?
Yeah, so great question. There are quite a few different diseases that we do vaccinate against. Most of those, in general, we vaccinate for as children. So, but that depending on where you grew up, what country you might have been in, what access to medical care, what the expectations were there, you may not have gotten those, right? So it absolutely makes sense that you might not be sure, right? So there are a few different diseases. So we mentioned measles. That's a really important one. We also usually rotate for tiny babies against rotavirus, which is a type of intestinal virus, can make babies pretty sick. That DTaP or Tdap that I mentioned, so diphtheria part is whooping cough, but it also includes tetanus and then pertussis as well. We vaccinate against polio. So some of us may be old enough to have parents or grandparents who were impacted by polio. Polio is virtually gone now, but was a very serious disease that could cause people to go deaf. That could cause paralysis, right? A very, very serious disease. Mumps and rubella are the other diseases that we vaccinate against with measles. There's those are sort of the most common ones. And some of them our expectation for attending school. So that MMR, measles, mumps, rubella is one that kids need to have for school. The DTaP or Tdap one, that's required for school. So usually children need to have evidence that they received that vaccine, or that for whatever reason they're unable to receive that vaccine, or their parents have chosen not to get them vaccinated. They need to have something signed off on. There's also vaccines, especially for older adults, against pneumonia. It can be a really important one as we get older, or if you have risk factors. Chicken pox, right? Varicella, that's one that is more recent. So I know as a kid, I just remember having to deal with chicken pox, right?
Yeah.
But kids these days, they get to have a vaccine to avoid that. There's also a vaccine for shingles.
Yeah,
So
that's
if you had chickenpox as a kid, you are at risk for developing shingles later in life. And that's because the chickenpox virus lives in our body and can show up later as shingles. So shingles is a vaccine that we can also get as older adults. So yeah,
So
there's a
that can
lot of
be-
them. And so checking in with your medical provider about like, hey,
Yes.
what do you recommend for me? And they can also look and see what you maybe already have had.
Thank you. Andy Lyons, I think you've done more than enough. You answer question beyond of what you were sent out to help with the public today. But we have, benefited greatly from your wisdom. Thank you. And I know time is running out. If there's
Lima, saya
anybody
pikir
else
kita
who
dulu.
wish to,
No, we have extra time, because we're starting late.
okay.
Oh, okay.
Yeah,
Yeah.
there's more time, so go ahead if you have any other questions.
Yeah, it's me, Linnea Kane. This question is based on myself. When I take the first vaccine on the COVID vaccination, and I was sick more than a week. And my question is, I know there's a different type of vaccine, but the thing I was thinking of when I get sick, and I was thinking that maybe there's a type of thing in that vaccine I was allergic to. That's why I get sick. So I stay with that confused on my mind up to now. And so I didn't take the second and the third. Yeah, I'm kind of afraid of sick again. So please, I need help with clear all those things.
Thank you, Lini,
Yes.
for your question.
I
sound
would
like
be
a little
scared
high school
too.
kid now.
Yeah. If you took a vaccine and you got sick, especially sick for that long, that would absolutely
Yeah.
make me feel nervous
Turn me
too.
off.
So there are a few things that could have happened. You could have had some kind of allergic reaction to something in the vaccine. Possible. It's also possible that it was just really bad timing. So I don't know if anybody's ever had that happen, right? Where, it feels like, gosh, this thing must have caused this thing. And as it turns out, it was just really bad timing and you were already infected with a cold and then you got the vaccine. Totally possible. There are also two different kinds of COVID vaccine that work in different ways. And I won't get into how they work. But they basically are just training our bodies in different ways. So you may have heard that, part of what allowed us to develop the COVID vaccines so quickly, in addition to having tons of money poured into it and all the scientists, so many scientists across the world working on it, which sped things up, is that those vaccines used mRNA technology. Sounds like DNA, not DNA. But mRNA vaccines work a little bit differently than the older vaccines that we have used. So there are still COVID vaccines that use mRNA technology, but there is also COVID vaccine that uses more traditional sort of vaccine technology. And so it might be worth talking to your medical provider and telling them exactly what you said to me. I got this vaccine, I got sick, it freaked me out. I want to, keep myself healthier and I want to protect my community, but I also don't want to get sick from a vaccine. And your medical provider can talk you through what your options are and maybe help you feel more comfortable with that choice. So the mRNA vaccines in general, people do tend to have a little bit more significant, often just a little bit more significant side effects where they're maybe feeling kind of yucky for a little bit. But you might want to ask your provider about the Novavax vaccine because that's one that works a little bit differently.
Thank you.
Thank you, Lini, and thank
Yeah.
you
You're
for
welcome.
the answer. Anybody else that in our guest panel with any more question, go right ahead. Thank you.
Felicia? Bessie Kamoto?
Okay, Dima, one last question. What about eggs? I noticed that all the forms, the vaccination forms, it's stated there, are you allergic to eggs? What does allergic to eggs got to do with all the vaccines? Because most of all the forms that question is on it.
Yeah, so there are just a couple of different vaccines that have used egg products in them, but they're none of the more common ones, right? So, flu and COVID and RSV, MMR, the measles vaccine, all the ones we've talked about, those are not made with any egg products, so it's not something that you need to worry about. They ask about it it's part of often the like regular screening, but it's not something that for most of the vaccines you need to worry about. But you can always let your medical provider or the pharmacist you're seeing know, and they'll know exactly what's in the vaccine product that you're using. I know also there are some religious communities or folks who have concerns about pork gelatin. And there is, in some MMR vaccines, there are some pork gelatin products. And so if that's a concern for someone, there is also MMR vaccines that do not have pork gelatin. So there are sometimes, there can be ingredients in vaccines that either people have allergies to or don't feel comfortable with for whatever reason. There's almost always an option available. But the reason that some of those vaccines and historically more vaccines had egg products was it was just part of how the vaccine, sort of the instructions teaching your body, it's how it was created in a laboratory, but not something that we need to worry about broadly now.
Thank you. Thank you, Bessie, for your question.
Thank you very much.
Yes. Now, I think I like to ask this. This has come from Louisa. What are the symptoms, like when you feel like that you have the measles? Because a lot of our PI folks, have the measles. How can you tell? And how serious is the measles?
Yeah, so measles usually starts like a lot of respiratory illnesses, which is what the measles is, right? So can start with a fever, a cough, like runny nose, congestion. What sort of differentiates measles is that it has a really specific rash, and that rash usually kind of starts from the top and goes down. Not always, though. And, for some people, measles can just be feeling sick. But the problem is, it can be much more serious than we realize. And it can cause really severe illness both immediately. So, like somebody gets sick and they get a complication like measles. I'm sorry, not measles, like pneumonia. Sorry. So they get sick and then they kind of immediately get ill. It can cause swelling in the brain, right? Encephalitis. And it can lead to death in some cases. But measles can also cause really severe side effects years later. So there have been cases of people who got measles as a very young child or a baby and then end up with complications years later and end up either getting very ill or dying from it. Measles also can do things like it can cause deafness. It can cause other sort of neurological issues, and
Right.
it can often cause what we call immune amnesia, which basically means, I mentioned when we're little kids, when we're babies, we often get sick really frequently because our bodies are learning how to fight against all of these diseases. Measles can kind of like wipe that out. It's like wiping out the hard drive on your computer or erasing the memory on your phone. And so then our bodies have to relearn those illnesses. So it can make us sicker for longer. So, people kind of can think about it as, oh, it's just a rash or it's just another, cough and cold. But about 1 in 4 people who get measles in the United States will end up in the hospital from it. And almost always the people in the United States who get measles are unvaccinated kids. The measles vaccine that we have, the MMR, so it's measles and then also mumps and rubella, is incredibly effective. When we get 2 doses, usually we get the first one around a year old, and then the next one around like 4-ish, between 4 and 6 usually. It's got 97% protection. So most people who get vaccinated as children are protected for the rest of their life at a very, very high certainty. And like I said, if, for example, you maybe are traveling overseas to another country with a baby who is not yet a year old and maybe hasn't gotten that vaccine, they can get an early dose. They call it a travel dose even, because we want to vaccinate babies. We kind of try to balance when is it the best time with their immune system and when they're likely to come into contact with a disease. So it's safe for them to get that early vaccine, but in general, we wait until they're about 12 months old.
Thank you so much. That is a very helpful information. I hope, Louisa, you heard all the information that Andy Lyons, vaccine educator, is sharing. That's very, very important, for us to be aware of all the things, that's happening. Sometimes we may not even realize, but we are, exposed to those disease, and that's why the vaccines, is very important. I think that Latu.
Yes. I don't have any other questions. All I have to say that I guess with Thanksgiving coming up, that we are grateful that we
yes.
have all this wonderful program available, especially
The
to
vaccines.
get vaccinated. And
Yes.
I know I have grandchildren. That's often when I was a mom, with my kids growing up, that's always good that the school requires their immunization
Yes.
records for every time they enroll. But I want to thank you for reminding us, and I guess that is vital to our existence daily. And I like the idea when you open up the session on our program today, when you reminded that having vaccination will also prevent us from missing work, missing out on social events, but also you also remind us about being around people of, I'm a senior, but of more seniority. That if I know that with this festive season coming up, if I know I'm sick, make sure I wear a mask so that I'm not, spreading out all this
Disease.
disease if I know I'm coughing. But also thank you so much also to both of you and also Katie.
Yeah, this is another one, I know that this question here may be already asked, but what vaccine
go.
should people get at this time of year?
So the most important ones to get, and I would say run out and get them right now if you haven't already, are flu, because the flu season is starting to ramp
Yeah.
up, and COVID. And then if you are older, so certainly if you're 65 and older, but if you're maybe a little bit under that and you struggle with other, chronic health conditions, look into getting the RSV vaccine. Also, if you're pregnant and the baby is due pretty soon, also consider getting an RSV vaccine as well.
Yeah.
And if you're pregnant and you've got a baby coming soon, check and make sure you've got your whooping cough vaccine and maybe all your other kids and grandmas and aunts and other folks who are going to be around that baby are also vaccinated against whooping cough with either a Tdap or a DTaP. So those are the ones I'd really be thinking about right now.
Right.
Oh, I have Betty Ryder was just asking, her daughter is pregnant right now. Is it safe, for the people that are in pregnancy, to get vaccinated, because of the new baby development?
Yeah, so it depends on the vaccine, and this is a great conversation for the individual person to have with their medical provider. But there are certain vaccines that are not only safe, but they're actually really good to get during pregnancy because protection can pass from the pregnant person to their baby. So we've seen some of that with COVID. We've seen certainly with RSV. So definitely have have them talk to their OBGYN or their midwife, whoever's providing their prenatal care about what vaccines to get while they're pregnant, and they can learn what vaccines are safe during pregnancy. Many of them are, though.
And I'm going to cut in. I think we're going to need to wrap up now
Yes.
because
Thank
Andy
you.
needs to get to another meeting.
Yes,
Yes,
thank
This
you
was a
so much,
great
Kate Cole.
conversation.
Yeah, thank you for this great opportunity, to sharing this very relevant information, before the Thanksgiving coming up, because this is a time of gathering, in families and a big crowd and a lot of the things, during the holiday. So everybody, we all thank you, and have a big shout out, for the public health, Seattle and King County, for giving this information. That's a precaution, very important for you to go and take your vaccines, to protect yourself, protect everyone else. And then now is the time, to wrap up. Thank you, Kate Cole, for communicate and engage us, with all the specialists, about the health. And thank you, Andy Lyons, the vaccine educator. Also, Lini Poloka, and Lini Poloka, she's also a nurse, for her clients. Yeah.
Thank you.
And also Pastor Asheri, also Elizabeth Yafukamoto.
Thank
Also,
you.
yes, thank you so much. And
Thank
also,
you.
also
And have a
Felicia.
happy Thanksgiving.
Happy Thanksgiving to
Thank you
everyone.
all.
And we'll have like a farewell song here. Please, radio engineer, David Unahefa, play a little song, saying goodbye for everybody. You can dance your day away.
Thank you. Bye.
One more
Bye,
day, and
Sylvia.
then we'll reach
Bye,
to the
everyone.
Thanksgiving of 2025. Happy Thanksgiving to you.